In functioning as a manager or a leader in the organizational structure in the health system where I work, I think that I could be successful. I would definitely need to develop a little more experience. We have what seems to be sort of a horizontal structure and a vertical structure, in that as a registered nurse without management experience, you can move into roles that help you get to managerial positions such as charge nurse or team leader positions, and then which is a horizontal move, and then move vertical into a position such as a clinical unit leader or a shift manager, and then on up to a unit manager or a nurse manager. In looking at Chapter 7 in the textbook, as well as the leadership skills questionnaire, I seem to score more highly in the administrative and conceptual tasks, in that I can critical think problems and am generally pretty good at using my resources to get things that I need and provide the things that I need for my staff. In looking at the textbook, I find that I'm highly organized. I keep a planner for my activities and keep my daily activities as organized as I can in a critical care unit. I'm good at directing others in giving clear, concise directions. I feel that I'm good with communication, and I do a good job of praising others when they do well and try to be sure that everyone feels like they're getting a fair deal. The article I found talks about making sure that all members of the interdisciplinary team are receiving the same level of training, from doctors to pharmacists to nurses, making sure that everyone's training is on the same playing field. That way, when they're interacting with the patient's getting less conflicting information, and all members of the interdisciplinary team are receiving the same approach. And I think that this is great literature, because oftentimes when I'm talking with patients, they're confused because one doctor has said one thing, another doctor has said another. A night shift nurse has said one thing, day shift said another, and the pharmacist may have come in and told them something totally different. So I think by getting everybody, all of those components of the interdisciplinary team on the same page and the same learning level, then it would make things a lot more clear for the patient, and after all, that makes better communication, makes for better patient care in the long run. To function effectively in the leadership role, I think, especially where I work, it's important to utilize all your resources to be in good communication with all departments, environmental services, dietary, nursing. You want to be sure that at any time, if someone needs help, that you can provide that help, and that you have the resources at your fingertips, or know somebody that can get those resources for you. That's something that I seem to do well. And again, as far as horizontal versus vertical structure, I tend to prefer the vertical structure, in that you kind of work your way up the ladder. However, I do like that my place of employment kind of has a horizontal or vertical leadership opportunities, where you can go a horizontal manner, and you can even change departments. As a nurse, you can kind of move horizontally within your role, and once you get to the department or the place that you want, you can then work towards moving vertically through that department and upwards in management.